cardiac part 2, shall we?
It's 2 o'clock on Wednesday. Good for me to take the quiz. I will. Okay.
All right. So, angina. There's 2 major types. That's chest pain, right? It's basically caused from a lack of oxygen in the heart. So winter is hopefully over, and hopefully we won't get any more snow. But you never know. So if I were to go out with the shovel and do like strenuous exercise, and my chest hurts,
Stable.
what is that called?
Stable angina.
Stable angina, right? If I stop shoveling, I rest, goes away, stable. I'm sitting on the couch, now I get chest pain.
Unstable.
Unstable. Then I do, it keeps and maintains long term. Stable comes and goes, unstable is constant. Okay? So when there's a myocardial infarction, so there's a clot in the heart. What do we want to do? What's the first thing we want to give this patient?
Nitro. Actually, no.
Oxygen. Mona.
I've heard everything of the acronym.
Mona.
We're going to use Mona.
It'll be oxygen.
Well, we give oxygen first, right?
Yeah.
Because what is the actual problem?
Lack of oxygen.
Yep, lack of oxygen in the heart, right? So the first thing you give is oxygen. Okay? We give them oxygen. Now we're going to give them
Aspirin.
Nitroglycerin.
Aspirin.
Okay, who thinks aspirin?
Wait, does it go Mona in order? M-O-A-N? No, right?
She said it wasn't like that.
No, it's not.
Nope.
I was just making sure.
Alright,
It's not.
who thinks nitro?
It's supposed to be
No.
Oxygen.
So it goes, I know the order, people. Settle down. Oh,
Yeah, whoa.
settle down now. In the back row.
Calm it.
Jeez. We're not in the club, okay? Stop dancing. Alright. Oxygen's first. Then we give a chewable aspirin. Okay? Because, what is the actual problem? Technically, it's a clot, right?
Yes.
So you give a chewable aspirin, which is very quick, easy to do, to help relieve the clot from getting bigger. Okay? Nitro requires what generally in this case? We can use a paste, right? Nitro paste on the chest. That's going to take some time, right?
Yes.
Aspirin will be absorbed pretty quickly. Or that's just going to require an IV. Chewing some aspirin, pretty quick, right?
Yeah, and nitro burns your tongue, gives you a bad headache too.
We'll get the nitro. Okay? Then we give nitroglycerin, right?
Yes.
So it's like oxygen's number 1. Aspirin, nitro, they're like 2 seconds apart. It's like boop boop, done. Like it's all done like the first 5 minutes. But instead of oxygen, aspirin, nitro, what's the last one?
Morphine.
Morphine. Why do we get the morphine?
For pain. For pain.
Pain and what else? The CNS depressant, right? What's going to happen to your heart rate?
It's gonna slow.
It's going to slow down, right? So heart's going to work not as fast. It's going to slow down a little bit, allow the heart to rest, so therefore we can relieve the issue. What does the nitro do?
Vessels.
It's a huge vasodilator, right? And so it's going to open up those coronary arteries to allow blood to get in.
Yes.
So nitro can be given sub-Q or IV, right? If we're giving sub-Q nitroglycerin, what do you tell your patient about the administration?
Sublingual. Is it sublingual?
Yeah, sublingual, what do you tell them?
It's gonna burn.
It's gonna burn in the tongue.
It'll be like burning tingling sensation under the tongue, right?
A headache is
You will have a headache.
after.
Okay.
Do not chew it?
No, you just, oh, you can't.
The burning means
Yeah.
it's working?
It does not mean it's working. It
Oh,
means,
that's other way.
because it can be, well, technically, burning can, it should have burn, but does not mean actually it's working. It could still be expired, but still be burning tingling,
Oh.
okay?
Don't be more than 3 days.
3 doses and how much time apart,
5 minutes apart.
right? So we take the first one.
After the first.
No.
Hold on. Everyone, take a chill pill, take from 11 down to 10, okay? Spinal Tap reference, it's great, good movie. Anywho, you're all too young probably.
I can hear if they keep printing the papers, I really can't. It's
That's the first time the paper got printed.
And every time they're doing the same thing.
There's been a lot of printing throughout class today, so everyone just, for the love of God, stop printing.
This is the first time it was printed while you talking, so.
It was printing in the first part of lecture too, people were printing stuff. Maybe you were printing something now, but other people were printing stuff throughout the lecture as well. I heard it go off multiple times today. I know it was having issues, sorry about that, but you can come to class early and then get your stuff printed before class, okay? Alright,
So I'm confused.
so we're talking about nitro under the tongue.
So I'm confused. So it's not oxygen, nitro, aspirin, and morphine?
It's oxygen, aspirin, nitro, morphine.
Because like Professor Moser told us.
She did give us an acronym,
Yeah.
that was ONAM. But now we're flipping the A and the.
Yeah, it's in the PowerPoint as oxygen, aspirin, nitro, morphine.
Alright, that's what I got.
I'll talk to her about it. I think it's in the grand scheme of things, it's not gonna be a test question, it's just more like practice thing. But it's gonna be easier to give your aspirin over your nitro, right? So that's why you give your aspirin second, because it's just easier to chew it. I'll talk to her about it. The main thing is, first is what?
Oxygen.
Right?
Yes.
The nitro tablet under the tongue. I had chest pain. When I take it under my tongue, should feel a tingle, right? I still have chest pain 5 minutes later. What do I do now?
Take it on the tablet.
Take another tablet, and then I'm gonna call EMS, right?
Yes.
Why don't I call them first?
Takes them a minute to get there.
Thinking it's gonna be a long time on the phone, right? We're talking for a while. So by the time you wanna fix your acute problem of the chest pain. So you wanna fix that chest pain and then call EMS. So when they're done, probably the phone doesn't take a while, you still have that third dose you can take, right? Take the 3 doses, 5 minutes apart. Okay? So side effects with nitro, we all said it's a headache, right? What is causing the headache?
Vasodilation,
The dilation of the blood vessels in the brain,
right?
right? What else is gonna happen to your body? It's gonna happen, what do you wanna assess for? Hmm? Blood pressure. Extreme hypotension, right? Blood pressure's gonna drop. Blood pressure's gonna drop. Hypotension. From the dilation. And then
Hypo.
what we can get, we can also get reflexive tachycardia. So if we stop, so blood pressure drops, what's gonna happen to your heart rate? Tension's gonna go up, right? Because your body wants to compensate for that drop of pressure. So we gotta be careful with that. What drug do you not want to give?
Viagra.
Some sort of erectile dysfunction, sildenafil, Viagra, because they act on the same vasodilators. Patient will code out.
What was your question?
Question is, what med do you avoid? What med do you have to avoid? And it's a question you're going to ask both men and women. Okay? Sounds weird, but it's also going to, Viagra also helps promote blood flow to kidneys. So if someone has like urinary problems or kidney issues, they can be in low dose vinegar as well as a woman. Okay? Yeah, it treats ED because of dilation, but it's actually helps increase blood flow to the entire genital urinal area. It can be used for other things besides just ED. I'm saying the blood pressure medication that just was more marketable as to fix erectile dysfunction because men like to have erecting cysts family. Alright. So other meds you already kind of covered in cardiac part 1, they're in this one too. That we have beta blockers, calcium channel blockers, right? Beta blockers. They end in LOL, right? There's cardioselective and cardio non-selective. Which one is cardioselective? Tropolol, atenolol, they're all cardioselective, right? So they're going to mainly affect the cardiac function. Which one's non-selective? Atenolol. So the cardioselective mainly affects